Hi everyone, this is Dr.RUkmani Choudhary and you're watching Everyday Health Result. My today's topic is esophagitis, that is swelling, irritation of esophagus food pipe. So in today's video, I'll be talking everything about esophagitis, what are the causes behind, symptoms and what are the complications. If you left this problem untreated, what complication? So complication will be there, allopathic mode of treatment, best effective homeopathy medicine. Watch complete video for complete information. If you're watching first time, please like, share and subscribe my channel for further notification. Start with definition. What is esophagitis? Esophagus, that is food pipe. So any kind of irritation or inflammation in your food pipe that leads to esophagitis. Now what are the causes behind this? There are certain risk factors who lead esophagitis, and these are having poor immune system. If you are immune compromised, you are having cancer or HIV or AIDS or having getting done chemotherapies, radiotherapies or any upper chest, any surgery in your chest part, upper abdominal region surgeries, or any kind of medicine allergies. If you had a lot of medicines in your past and due to that you are having allergies from them, so these are certain risk factors. Being obese, having obesity, one of the reason again. What are the types of esophagitis? There are certain types and these are four. Majorly there are four types. So let's start with eosinophilic esophagitis. Sometimes you have allergies from certain food, and these can be peanuts, tree nuts, soya, milk. So this is called allergic esophagitis or eosinophilic esophagitis. Means you have more response towards certain allergens. So you have more eosinophilic counts, and this is called, and your esophagus food pipe, there is a swelling in that area. So this is eosinophilic esophagitis, means high eosinophilic count due to certain allergens. Next comes reflux esophagitis, that is when you have GERD problem, like these are gastroesophageal reflux diseases. When your stomach acid goes back in your esophagus, back in your food pipe, and that frequently irritate your esophagus, so you have swelling in that part, reflux esophagitis. And next comes medicinal esophagitis. Medicinal esophagitis means certain type of medicine that you have with less water or not enough water, so they take longer time to get absorbed and they lingering, they stuck in your esophagus for a longer time, and they can even irritate your esophagus. So this is medicinal esophagitis. Infectious, so sometimes you have certain kind of infections, and these can be bacterial infection, viral infection, or even fungal or parasitic infection. So in these kind of cases, these are very rare, but yes, sometimes you can have infectious esophagitis. So these are the four major type of esophagitis. So symptoms, what suffering you can have, what sign of symptoms you have. Common the symptom is that is dysphagia, difficult swallowing. You have your esophagus is inflamed, that is swollen up, so you have difficult while swallowing. There's a difficulty and there's a pain, dysphagia. You have sore throat, there is a hoarseness in your voice, and you have cough, and if the problem is severe, you even may have breathing troubles. Sometimes you have chest burn, heartburn, chest pain sometimes, and there can be nauseatic feeling, vomiting, decreased appetite. Diagnose this condition. So diagnosis is mainly based on your medical history. What medical history you have? Are you having any kind of allergy? So your food allergy tests are done, your skin allergy tests are done, and yes, there is biopsy. Tissue sample is taken, and that is a study further is done. Endoscopy, yes, and barium meal, that is upper GI series. These tests are done to confirm your diagnosis. Now the complication you have if you left this problem untreated. Yes, you do have complication, and these are like Barrett esophagus, that is damage in your esophageal lining due to frequent irritation, and this is like known as the precancerous esophagus. There are precancerous changes. And the next comes the perforation or ulcer formation. If you have, there is a frequent acid reflux, you are having, there is a backup of stomach acid frequently into your esophagus, so yes, there are chances of having ulcers and holes, and this is called esophageal perforation. And stricture, narrowing of esophagus, sometimes it is so much inflamed that there is less space, that is narrowing, and this is called esophageal stricture. So these are the certain complications if you left this problem untreated. So whenever you feel yes your symptoms are bothering you, just see your doctor right away. Now The allopathic mode of treatment, based on underlying cause, what underlying cause you have, whether it's a infectious one, so you are given accordingly, treatment accordingly, like you're having bacteria infection, so there is a antibacterial therapies, antiviral therapies, antifungal therapies, depending on your underlying cause. And if you're having allergic, if you're having eosinophilic esophagitis, so your allergens are removed, allergy test is done, and your certain foods are checked, and yes, that part of food is eliminated. Esophagitis, eosinophilic esophagitis, and antacids are given, proton pump inhibitors are given, sometimes oral steroids are given. So this depends on your underlying cause. Now the best effective homeopathic medicine in esophagitis cases. These medicines are not the limited one. These are the some of the medicine that are most indicated. These are the general one, not individual one. You just go with your case, your symptom, and all these medicines link you may find in description box below if you're watching on YouTube. Don't buy all medicine, not required. Just go with your case, go with your symptom, and you may find different color medicine. Like let's talk about Elimina. This is the blue color medicine. This is the company color. You may have different color, even different form of the medicine, even the place you belong, but just focus on the medicine name, whichever form you get, pills form or medicine form or even mother tincture form, whatever you get, just focus on the medicine name and the symptom. Illumina. So homeopathy is the medicine that is given when you have difficult swallowing. There is a dysphagia, difficult swallowing, and particularly for solid food. So, and if you take by small quantity of solid food, so these are the indication of alumina, and you take warm water. So warm water gives some relief. These are the keynote symptoms of alumina. These are the oral form of the medicine. Just take with the help of dropper, 1 or 2 drops 2 or 3 times in a day before having your meal. And this is the medicine strength. So just start with the lower 30. This is the 201 medium one. Like carbohydrate, you might have heard about carbohydrates, gas, acidity. This is given frequently prescribed medicine in gas problem. Gas is that you have epigastric pain, you are having esophagitis, there is a swelling in your esophagus, with that you are having epigastric pain. And particularly carbohydrates indications are for upper GI tract. These are having problem in your upper gastric symptom and esophagus particularly. So this is great medicine in treating epigastric pain. Causticum is the medicine. The symptoms are when there is a constant sensation that something is lodged in your throat or in your esophagus, lodged, the food is stuck in your throat, and so this is the sensation, and you are having even hoarseness of voice, again a symptom of esophagitis. So this phosphorus in homeopathy given again when you are having burning esophagus, there is a burning pain and more difficulty while liquid swallowing. You have more problem. 200 potency with the help of dropper, 1 or 2 drops 2 or 3 times in a day before having your meal. Arsenic amalgam. Arsenic amalgam usually tops the chart. Arsenic amalgam covers all the symptoms: nausea, vomiting, throat pain, sore throat, and dysphagia, difficult swallowing, all the symptoms. So this is the top remedy in treating esophagitis. Same way, 1 or 2 drops 2 or 3 times in a day before having your meal. So hopefully this video can give you some amount of help. If you find this video knowledgeable, informative, please like, share and subscribe my channel for further notification. If you want individual video voice consultation, you can even drop your message on given below. Thank you for your time. Thank you for watching. Keep watching, keep supporting. Thank you so much. Thank you.